Hello, I'm Dr. Sanjay Panicker. I started Amrita Homeopathy in 1997 in Kerala. It's almost 18 to 19 years since we started the clinic, and this is our first clinic in Bangalore on Koromangala 80 feet road, 4th block. There are multiple causes for abdominal pain in a person who is in his 20s. But when you find the combination of abdominal pain with blackish stool, then the causes for this particular thing can be cut down to a smaller list of diagnosis. Very common reason why a person can have blackish stool is because he is on too much of iron supplements. That is very commonly seen that people who take iron supplements complain that their stools have become very black, sticky. It also happens by taking certain fruits like blackberries that the stools can become blackish. This is natural and normal and need not worry about it. That is called as false melena. Melena is blackish stool where you find blood in stool, and when the blood is from the upper part of the intestinal tract, then by the time it reaches the rectum and comes out in the form of stool, it turns blackish. If it is due to supplements and due to medicines, then it is not blood, and that's why we call it as false melena. But in real melena, there are few causes which can cause this. That is, if you have an ulceration, even gastritis can cause slight erosions, and there can be blood in the stool which is blackish in color. If there are some varicose ulcers of the lower end of the esophagus, that can rupture, foodpipe can rupture, and then that can cause blood in the stool. In people who have severe vomiting, sometimes there can be a tear of the esophagus. This is called as Vallerie V tear, and that can cause melena. So the pain in the abdomen can be related to any of these things. So if these factors are there can be blackish stool and can have pain in the abdomen.